I'm Susanna Proudman and I'm a rheumatologist at the Royal Adelaide Hospital. Scleroderma is an autoimmune disease in which the immune system causes inflammation and damage. We first became interested in researching this disease when the Australian Scleroderma interest group was formed. I was one of the initial organisers with Melbourne colleagues in 2007. And there are now more than 2,000 Australians with scleroderma enrolled in the Australian Scleroderma cohort study, which was set up by RAHsearch. And this has been an invaluable resource that has allowed us to learn directly from patients about what this disease is all about and develop research studies to try and find better ways to manage their sometimes quite devastating complications. Well, we've certainly for the first time demonstrated the burden of this disease in Australians with scleroderma. The quality of life for these people is at least as bad, if not worse, than other chronic diseases like heart failure and chronic lung disease. And in some people, it can reduce your life expectancy by up to 20 years. Among the rheumatic diseases, it's also the most costly to our healthcare system. And this is probably because of the multiple organs that are affected. Our focus has predominantly been in the early stages of our research on one of the heart-lung complications called pulmonary arterial hypertension, or PAH, because this has a major impact on long-term outcomes. This is a condition where the blood vessels in the lungs are narrowed, and this can lead to people to become lethargic, find it difficult to exercise, and then eventually find it difficult to do even ordinary activities of daily living, like dressing and showering. And that means it's actually quite hard to pick up because the patients and even the doctors themselves can sometimes attribute this sort of general lack of energy, I suppose, to other parts of the disease, things like malnutrition and muscle involvement. But we also know that if you do pick this disease up early and start treatment with some of the therapies which we know are effective, that we can improve outcomes with this disease. So we focused on finding a new way to try and detect this disease early. There is a recommendation that people have an ultrasound of their heart, or an echocardiogram, but this can be quite time-consuming and I guess costly if we have to do this in every patient every year. So we've looked at an algorithm for identifying people early that involves a lung function test and a blood test. And we found that this is a very sensitive way to pick up people early with PAH, and in our patients has improved their longer-term outcome. It is in the stage now where we're ready to implement that, and we have a project underway in Queensland for the community rheumatologists to be able to apply this screening test every year without having to refer people for echocardiograms every year to really demonstrate that it can be easily applied and pick up patients much earlier than they would otherwise. Yeah, so scleroderma has very wide range of severity. There are some people who have relatively mild disease and some who have multiple organ involvement, which can be very severe and have other problems. But actually all of the patients at some point in their disease are at risk of developing pulmonary arterial hypertension. About 10% of them actually do. So there can be a tendency to perhaps wait a long time before looking for it because it can occur later. But in actual fact, we've demonstrated it can occur at any time. So really every patient should be screened after they've been diagnosed with scleroderma for PAH every year. We've shown across the board that in general, people's outcome is better if we detect their PAH early, treat it early, use combination therapy. And we know that will lead to better outcomes across the board. But there are always a few memorable patients who have perhaps reported maybe a slight change in their exercise capacity. The tests that we normally do have been normal. I'm thinking of a woman in her 40s, for example, who used to be very fit and could walk on the beach, walk up the hills around the beach in the sand dunes and things quite comfortably. But then sort of reported a decline in her exercise capacity, and she had lots of cardiology tests with a cardiologist, and no particular cause could be found. And then by looking at some of these components of the screening algorithm in a bit more detail, it seemed that she really was at higher risk, and indeed when she had the right heart catheter that's needed to formally make the diagnosis of pulmonary arterial hypertension, that was indeed the case. And she's now on treatment and doing well. Well, by identifying complications of the disease early and starting treatment early, we hope to improve outcomes across the board. And then within individual cases, we hope that by focusing on a cohort setting where we see patients on a regular basis, we assess them regularly according to a protocolised system, that we won't overlook any important markers of future complications, and that we can help individuals with their complications as they arise. We have a nurse practitioner who's now specialised in scleroderma, and she's become an expert in assessing patients, wound care, and helping them with their pulmonary arterial hypertension to understand their disease, educates them about their medications and helps them access their medications. So we think that by embedding research in the clinic on a daily basis, really for every patient who agrees to participate in the cohort study, that we can improve the quality of the care that we provide. We've also had an impact on policy in terms of being able to access medications through now the ability to prescribe more than one therapy for pulmonary arterial hypertension at the same time. And we're also having an impact on practice in that our screening algorithm is on the verge of becoming widely available for rheumatologists in the community and in other hospitals to be applied for all their patients with scleroderma across Australia.